connect today with our skin expert, Dr. Amrita Srivastava, live from Lucknow. Dr. Amrita Srivastava is a renowned skin specialist, dermatologist. Doctor has over 10 years of experience in the field of dermatology, owner and founder of Parijat Skin Clinic, Lucknow. Today, Dr. Amrita will share with us on sunscreen protection for acne prone skin. Welcome, doctor. Very good morning to you.
Very good morning to you and all my viewers. A very
Yes.
warm good morning to all of you.
Dr. Amrita, today we'll talk about sunscreen. We'll discuss why sunscreen is so important for our skin. So first of all, I would like to know, why should we wear sunscreen every day?
We should wear sunscreen every day. It is a very good statement by you because it is almost like a cover of our skin. Our skin is exposed to so many bad radiation, including the visible light. People used to say we never go outside in the sun. Nobody go every day on the beaches and they stand in the sunlight, but we live in the sun, in the UVA radiations, and also on the visible light, including the blue light we are facing just now with the screen. So these all lights are dangerous in the large quantity. The cumulative effect we used to face in our daily routine, and it damages our skin and causes various type of pigmentation and wrinkling, aging also. And in the long run, it can causes various type of skin malignancies. So you should wear your good sunscreen on your skin according to your skin type on daily routine, either you in the inside or go outside.
Right. So you're trying to say that as people have this notion that if I'm going out under the sun, then only I'll use sunscreen. But you're saying even if you are inside, no matter where you are, when you are, what you are doing, you need to wear sunscreen, because it's not only protecting you from the sun, it's also protecting you from the lights that we face every day, even inside our home or office, etc., like the laptop and mobile screen you and
Yes,
me are using right now, right?
yes.
Okay, now whenever we go and buy a sunscreen for us, there is a term called SPF and the ratings, 30, 15, 20, 25, 50, 60, and we are not aware of what SPF and what SPF levels mean. So what does SPF level mean, and why we should know about it while choosing a good sunscreen for us?
SPF is the sun protection factor, which is basically a factor which can you usually understand in not in the scientific language. The amount of the sun which causes erythema, basically redness over your skin, divided by the amount of the rays which causes negligible effect. So that amount, when we combine in the various type of molecules, which reduces the amount of the sun which causes your skin red or erythematous. It causes the sun protection factor, because whenever you get erythema over your skin, it causes later on pigmentation and various dangerous side effects. So first of all, our aim is to reduce the redness over the face when you get in the light or in the sunlight. So either it is UV rays in the outside, visible light in the home, or infrared in the kitchens and various type of chimney factory workers. So the amount of the sunscreen which reduces the redness over your face, it cause basically known as sun protection factor. And there are various rating, as you said. But for Indian skin, because actually skin type is from the Fitzpatrick grading 1 to 6. So Europeans, Americans are basically type 1 of skin type, very fair, and we are wheatish of complexion. So 30 to 50 SPF is adequate. So if you are indoors, 30 SPF is adequate, and if you are going in the sun and going to the beaches and sand and snow, then 50 and above SPF is required for your better sun protection.
Right. So there is a technical part to it, a whole formula to it, but you don't need to understand it. You just need to understand what's your requirement, what's your skin type. So if you are indoor, even a 30 SPF sun protection factor level is good enough. But if you're going out under the sun, like if you're going uphill or if you are, going to the beaches, then you need little higher level of SPF. Now, another question that comes many a times when we use sunscreen is how much quantity of sunscreen is adequate and how often we need to apply or reapply that sunscreen.
It is very important because in our country people are spending more money in all the things, but they are always try to reduce the quantity of cream and lotions to save the money. But if you are applying sunscreen, just applying sunscreen is not adequate for your face. If you are using a cream based sunscreen, one finger unit, in the index finger from the tip of the from the tip to the first crease of your finger is adequate amount for just only for your face only. And if you are applying a lotion based sunscreen or gel based sunscreen, then half of the teaspoon is adequate for your face. Again, the half of the teaspoon is adequate for your neck, and for the body part 3 to 5 ml for each arm is adequate amount of sunscreen. And just only application is not required. Depending on your work style, repetence and the frequency of sunscreen is very important. So if you are more exposed to the light, then apply the sunscreen every 2 to 3 hourly. And if you are in a home, then twice daily, in the morning and afternoon, sunscreen is adequate.
Right. So it depends upon a lot of factors like your nature of work, because how much exposure you have, under the sun. It's very important. But do take the adequate quantity of sunscreen and apply it as often as possible as per the requirement. Doctor, we would also like to know how is the effectiveness of sunscreen measured? How do we measure that?
uh, how to measure the effectiveness of sunscreen? If your skin is protected well, you never developed any type of dullness over your face, the pigmentation over the very the important part of your face like convexities, you never get heat burns, the brownish pigmentation over the side of the face, and your skin become very dull and wrinkled in the time run. Otherwise, in small children, in adolescent and school going children, get the very dull leathery type of skin, and they got various type of eruptions over the ear and the side of the face. So these are the signs where people not using adequate amount of sunscreen, and their skin become of various complexion, like somewhere white, somewhere dark, and they got the dyschromias. So then they are, if they are using sunscreen, they are not using the adequate amount of sunscreen.
Right. So it's very important to, the A, use sunscreen on a daily basis. B, use the right kind of sunscreen for your, as per your skin type, as per your skin requirement, and adequate amount of sunscreen that you need. As you just mentioned that kids, children's, when they go out, because they play a lot under the sun, they do a lot of activities under the sun, they are mostly under the sun, but many a times parents doubt whether they should use sunscreen on their kids or not. Please clarify our doubts.
It's very important. Sunscreen is safe. In fact, chemical sunscreen is safe above the 6 month of age. And our kids are more prone for damage. People are always concerned the vitamin D synthesis. The amount of UVA we get is more dangerous than the a minor amount of vitamin D which we not get. We generally get the vitamin D from our food sources. So please don't worry about the vitamin D synthesis. Sunscreen don't hinder your vitamin D synthesis in the sun. So for your kids also, use sunscreen accordingly. If they got dermatitis and their skin is very sensitive, then physical type of sunscreen or moisturizer base of sunscreen is good for them. And if their skin is normal, then any type of chemical based organic and inorganic sunscreen, physical sunscreen, are good for children. And if they are playing in the lot of the time in the playground, then advise them to apply at least 2 to 4 hourly for good skincare. Otherwise they got tanned and later on got very various type of diseases over their skin.
Right. So it's very important to start at the right time. So don't, be super late just for the reason that you were not using good sunscreen or your kid were not using the right kind of sunscreen. So apply sunscreen uh, above the age of, 6, as doctor just have explained. It's super safe for even the kids. So do apply sunscreen on them as well. Now, many times what happened, doctor, as you have just said that, when people are out, they sweat a lot. They have different kinds of or nature of works, like people who are in sales, like people who are in field all the time, like athletes, sports person. They may sweat a lot, and all the sunscreen that they have applied may just wash away. Now, the thing is, they can't keep on applying the sunscreen every 5, 10, 15 minutes. What should they do?
Basically for the athletes and these type of people, swimmers, we have waterproof sunscreen or water resistant sunscreen with the SPF more than 50 grading and the PA value more than 3. So this type of sunscreen, basically the PA 3 plus and SPF 50 with water resistant sunscreen, if you dip in the water twice, it does not wash out from your skin. So for that type of individuals, water resistant sunscreen is advised, so they can use it, and with the sweat it cannot be washed out. So they can use infrequently, like in the 3 to 4 or 5 hours.
Right. So, as per your requirement, you have various formulations, various kinds of sunscreen. Just go and choose the right one. So, doctor, when individual decide what will suit him or her, shall he just go and buy it over the counter, or we need some experts consultation before we go for and buy a sunscreen for us?
Better is advise your dermatologist.
Okay.
Um, yes, it is very required because in the today's market, there is in general store or cosmetic store or medical store is full of sunscreen.
Right.
And once people get some of the reaction, they got anxious and they stop the use of sunscreen. So if they are not aware at all, better to go a dermatologist for a proper consultation and then use the sunscreen accordingly. You should not required to go frequently to a dermatologist for your sunscreen changes. So depending on your skin type, you are, if you are acne prone, then gel based, and if your skin is dry, then cream based. These are very basic thing, and we generally aware our patients in various type of conferences and various type of seminar about them, so they can hear us like in this way on your various channel to a authorized and a qualified dermatologist, not anyone.
Right. So go to a dermatologist, consult a skin expert before buying a sunscreen, as sunscreen is one thing that you are going to use for the longest time, and for the, even in a day, you need to apply it more than once. So it should be of the utmost quality and as per your skin requirement and your skin type. So better to be safe, and please consult your dermatologist for a good sunscreen that they may advise. Now, doctor, you just mentioned that there are various kinds of sunscreen. You have physical sunscreen, you have chemical sunscreen, you have organic, inorganic sunscreen. Please elaborate a bit on
Actually, sunscreen is based on various of the skin types and various of the diseases also. in some patients we have from the childhood various of type of genetic disorders where skin is very fragile, so their skin not hold any type of chemical, and if they got various type of eczemas and dermatitis, for that type of skin physical sunscreen in which no chemicals are there is advised, basically zinc based sunscreen. And nowadays micronized form of zinc is available, so there is no whitish deposition which we see, which we can see in the our old days. So people get whitish or pinkish type of appearance. So nowadays micronized zinc is available, basically zinc and titanium dioxide based sunscreen, which causes no effect, no harmful effect on your skin. It just scatter all the light, come over the skin. It reflect only, it's simple physics only in the sunscreen. And in normal skin type where there is a skin is very normal, not very sensitive to any type of physical agents, then organic sunscreens are better because they there is mixture of organic, inorganic and physical type. Physical scatter the light, excess of the light. Organic absorb and reflect the various wavelengths of the light, and it causes better skin protection in the long run, if, from the various carcinogenic effect. So they have different type of filters of, for ultraviolet A, for ultraviolet B and visible lights. So compound sunscreen is anytime better, but where the skin is sensitive, then we use physical type of sunscreen, and children also, because parents are very sensitive about the various type of chemicals. And for very dry skin and hospitalized patient, we any acne patient, sometimes we prefer moisturizer based sunscreen.
Okay. So only your skin expert, a dermatologist, will able to tell you that what's your skin type and what you need. So better to go and consult your dermatologist before choosing the best sunscreen as per your skin requirement. As you just mentioned, doctor, regarding the acne prone skin. Now, people whose skin is more prone to acne, people who have acne, have this notion in their mind that sunscreen is going to make the condition even worse. And they try not to use sunscreen or not to include sunscreen in their daily skincare routine. What would you like to tell them?
In acne also there is various type of grading. If a patient come with a severe acne, grade 4 type of acne, then their skin is breached all in all over the skin, over the face or neck and other body area. They got breached and abraded, so their skin is more fragile for any damage. So when they go, if there is lot of infection, then we withhold sunscreen for a time, and we advise generally physical type of barriers, like they can use hat or a cotton cloth for cover their face. But meanwhile, when the infections settle down in a 1 week to 10 days, we advise them a good sunscreen with the barrier protection, either moisturizer or gel based sunscreen. So the moisturizer and gel reduce the sebum secretion, and the sunscreen protect their skin because their skin is already breached. And
Mhm.
in normal acne patient, sunscreen is very important because with the sun, our skin got various type of antigen presenting cells, which causes various type of inflammations and clogged pores, which is known as comedons in our language, or blackheads or whiteheads. So sunscreen is important in the mild type of acne, almost required. But in severe, we can withhold according to type of infection in meantime in for 5 to 7 days, but not for a long run. Similarly, with the various type of medications, skin is more prone for sun, because for acne we using the photosensitizing drugs, so they got tanned skin with the treatment also. So sunscreen is another way is also important. Bacteria causing acne are also photosensitive, propionibacterium acne. So for all the measures, sunscreen is very important for acne patients. So they not misguide with all the beliefs, and they follow the instructions of dermatologist accordingly.
Right. So if your skin is acne prone, be super careful. First go and consult your dermatologist so that they can diagnose what kind of acne you have, what stage is it, and what are the various causes of those acne, and then they can suggest you prevention or treatment. But anyways, sunscreen is very, very, very important, and please start using it if you are not yet using sunscreen. Now, there are so many excuses that people give. I'm sure you have heard them too, that, we sweat a lot when we use sunscreen, or we get acne, or our skin becomes very oily, etc. So they stop using sunscreen. So what would you like to tell them?
Basically, sweat is normal in basic organic or compound type of sunscreen because there is an exothermic reaction. Our sunscreen, various type of filters in the sunscreen absorb the longer wavelength and they reflect the light, so it causes some of the heat, so you can have some sweating over your face, but no need to worry about that because it not washes your sunscreen and it not causes any harmful effect. But patient if got very irritated with the heat and the sweat, then we use salicylate less sunscreen. The salicylates in the sunscreen basically cause this type of reaction, so salicylates and ceramides we can avoid that type of chemical in patients. So now we have a lot of basket according to patient need because nowadays patient are very concerned about various things. Some are from the fashion industry, some are from the various type where the face value is very important for them. So with your need we have a lot of basket, so no need to excuse for anything. You just mention your requirements. We have various type of sunscreen which can reduce the sweat after the application, and the dullness is basically this is a transient because it just because of the physics behind the sunscreen, the reflection of the light. So in that cases we have matte finish or gel based sunscreen which doesn't causes this type of appearance over your face.
Okay. And any particular ingredients we need to see in sunscreen formulations for the acne prone skin before buying it?
Basically, for acne patients, we use gel-based sunscreen, and depending on the type of acne and grading, we can use physical or organic or moisturizer-based sunscreen. So, ingredients, I don't think patient very understand the ingredients.
Mhm.
So, better for the assessment of the patient is important. In acne patient, important, and for normal patient, they can use various common filters like cinnamide salicylates, and nowadays various advanced type of filters, also antioxidants based vitamin C, vitamin E based sunscreen are also there in the market for better effect and for pigmentation.
Right. So there are various formulations that are available in the market for sunscreen. You have spray, you have cream, you have gel, you have lotion-based sunscreen. But it all depends on the quality or the type of your skin or your skin requirement. But in case you have any issue, please go and consult your dermatologist before buying a sunscreen. So let's not do any harm to our skin before it gets too late. I'll also pick some of the questions of our viewers who are live right now. Sarika Bakshi is asking, ma'am, I have darkness on my lips. What should I do for this?
Basically, darkness of lip are due to many causes. First of all, many of the people having tendency to lick the lips. So if you have the habit, change it. Use of various type of toothpaste having different type of colors. Colors are not required; they are just advertisement. So use plain white toothpaste. Again, rubbing of your lips with various scrub is also dangerous. Use of a good lip balm with sunscreen SPF factor at least 10 to 15 is important. Use lipstick accordingly with your use, and a good brands is important.
Right.
And some of the diseases also have the lip darkening. So in that cases, if it not resolved with the common tips, then go to your dermatologist.
Right. And many a times when a normal person applies sunscreen, he or she will always be in doubt, what should I do about the lips and the under eye or the area surrounding the eye area? Should I apply sunscreen on my lips and under eye as well?
Basically, nowadays lip balms containing some type of chemicals which provide sun protection is there, because sunscreen, normal sunscreen over your lips causes sensation and some type of taste changes, and similarly under the lower eyelid is it is adequate, but on the corner of your eyes you should avoid sunscreen, it causes a stinging sensation. So
Oh,
in that cases lip balm is a good option for your lips.
right. So you can go for a lip balm which has some sun protection factor, 10 to 15 as the doctor just have, prescribed. Shivendra Mishra is asking, is there a proper way to cleanse in my face so I don't get acne?
Yes, for acne prone skin, various type of cleanser which have no soap is available in the market with various OTC brands also. But better if you have acne prone skin, once you go to a qualified dermatologist for proper consultation, and better is don't use any cleanser or face wash so frequently if you have acne prone skin, because it causes compensatory sebum production. So if you have tendency or if you want, then use plain water for frequent wash, and any cleanser, good cleanser and face wash according to your dermatologist when you come from outside to clean your face.
Right. So too much of cleansing is also not advisable, especially with cleanser or face wash. So restrict it to just one or twice in a day, or when you are, you come back from your work, etc. Otherwise, you can use just plain water. So there is definitely a way to cleanse in your face so that we can prevent acne formulation. Palak Dubey is asking, ma'am, can I take any vitamin supplements to remove acne?
No. Acne is basically inflammatory disorder where there is a basically role of the excess of sebum production and inflammation caused by bacteria. So no direct effect with any of vitamins. In few of the studies, it is seen vitamin E deficiency and essential fatty acid deficiency causes more inflammation in the sebaceous glands. So you can reduce it by adequate intake of sprouts and nuts in your diet, but not any over the counter vitamins because it has excess amount of vitamin.
Right. As you just mentioned, that we should include a lot of sprouts and salad in our, diets to avoid having acne. But other than salad and acne, any specific kind of diet that we should follow for a clear, glowing, healthy skin? And does any of the fruit have the sun protection factor that we can do, by intaking those fruits or vegetables, etc.?
It's our nature only. In the summers, we have lot of mangoes, and mangoes are very rich in vitamin A. Vitamin A is very important for the sun protection. So God gives us all, and the nature provides us all. Watermelons and muskmelon is very good source of vitamin B12, water, and various nutrients which provide good sun protection. So using of the seasonal fruit is important. Don't go for fancy items, exotic vegetables and fruits. Use your nature and eat what your nature provides in every season. So in this weather, melons are very good for your health, lemons and mangoes, but not in excess amount, because mangoes are also rich in sugar content also, and sugar again increase your acne and causes various problems. So mango in adequate quantity depending on your health.
Right. So excess of everything and anything could be dangerous. So avoid that. But yes, nature has all the solutions for us. Please include a lot of seasonal fruits and vegetables. Definitely don't go for exotic fruits or vegetables. Just go whatever is available in the local market. They should be fresh. Eat them. And doctor, people also have this tendency like if I have mangoes, I'll eat a portion and then apply the rest of the mango on my face, or rest of the tomato on my face, or rest of the fruits on my face. Are they good for our skin, or does they do any harm, etc.?
Yes, normally if the skin is not very sensitive, some of are blessed with a very good skin inherently, but our skin pH is acidic, it is 5.5, and our hair pH is also more acidic, 3.7. So any alkaline thing you apply, so it can cause damage to your skin. So better to not get the food items on your skin directly, because it is not pH balanced and it can causes various type of allergies. Better to eat from our blood, we can get various things for our skin. Our skin is not a dead tissue.
Right. So if you'll have a good intake of fruits, salads, vegetables, juices, etc., your skin will get the glow that you're looking for. And for the external part, of course, a proper cleansing, a proper moisturizing, good sunscreen is what you need. Samrat Jat is asking, is there foods or other things I should do or use that will lessen my acne?
Yes, for acne, diet is very important. So hyperglycemic food like chocolates, ice creams, pizza, burger, excess of milk and milk products are dangerous for acne patients, because it causes inflammation in your body and in your skin. And seasonal fruits, green vegetables, sprouts, adequate amount of dry fruits except of the cashews is important to take for a proper balance in your diet, and it can reduce the acne also.
Right. So a healthy, a balanced diet is what actually can, supplement your skin health. Palak Manoj Sharma is asking, I have seen a lot of beauty products with mint in them lately. Are there actually benefits to use these products with mint, or is this just a trend?
Basically, people are frightened with chemical terms, and they are very normal with, and they used to with the chemical terms. So these are the all marketing with the various companies, the mint and tea, green tea extract and all, but they have not a very you can eat mint in your various type of beverages you can made in your home, but mint for application and in the products is not of any of scientific value in the literature.
Right. So they are just marketing gimmick, don't go by them. And doctor, I have also seen people with sensitive skin getting a lot of allergies due to, mint or these so-called organic products. Those are not organic products. They just say that we have used the extract of mint, etc. So can they, do make your skin allergic as well?
Yes, we, uh, we generally recommend the products which are scientifically proven. Our any drug in allopathy, some people are very frightened about allopathic product, but we have a six uh, ladders way to filter our drugs. So our drugs are very safe, and we know the side effects of all of them. And some companies are under the cover of organic and ayurvedic, they form various type of creams and formulations which are not even tested, and they causes various type of allergies. And in our opds, a lot of patient came with various type of problems, burn, vitiligo, white skin type, and various type of skin problems in normal our OPDs with these type of formulation. So don't waste your time and money with them. There is nothing natural, I think. So better go for scientifically proven and authentic products for your skin and for your another way for your health also.
Right. So, if you want to use natural products, use it for eating, drinking, etc. You have all the fruits, vegetables, etc. But for don't get scared of in the name of chemicals. If I ask you to take water, you will take it without consulting anybody else. But if I ask you to consume H2O, you will get frightened. You'll get scared. But the thing is that H2O is the chemical name of water only. So, we are so scared of these chemical formulations or names. So just that's why we always advise you to go and consult your dermatologist who can actually advise the best product for your skin as per your skin type and your skin requirements. But yes, don't get carried away by all the marketing gimmicks that's happening, especially these days on social media. Just stay aware, stay healthy. That is very, very, very important. Let's pick few more questions from our viewers. We have Ishita Jha asking, is my acne problem due to hormonal imbalance?
Yes, acne, a portion of acne is due to hormonal problem, basically after the age of 25. In the adolescent age, we got the adrenal surge of hormones, and got our adolescent group of patient got acne. This is normal. But if you are getting acne and severe type of acne after the age of 25, it's mostly more than 99% hormonal, in which some of the hormones, top of the list is thyroid is abnormal, and later on prolactin and sugar abnormalities are the other common hormonal problem in acne patients.
Okay. Ruchi Sen is here asking, ma'am, what should I avoid if I have an acne prone skin?
I already told, avoid all the junks and excess of sweets and excess of milk. It is the key factor to avoid your acne and stress also, because acne one of the most common causes is stress. If you are not getting good sleep, you are very stressful, then your hormone system got disturbed, and you get acne.
So stay calm, stay cool, have a good sleep, eat healthy, drink a lot of water is what doctor is suggesting. Kamal Dikshit is asking, ma'am, how can I prevent acne naturally? As we know, prevention is always better than cure. So is there a way to prevent acne?
Yes, acne is a metabolic disease now, like sugar and blood pressure. Because various type of inflammation causes acne. So various type of inflammatory food which we eat, like I already mentioned, chocolate, ice creams, burgers, they are very hyperglycemic. They increase the sugar content in the blood uh, in a small amount of time. And soft drinks are dangerous. They are just dangerous to the health. So these type of food, excess of milk and milk product, red meat, so this type of food causes inflammation in your body. So reduce the amount as you can, eat healthy and balanced food, exercise regularly at least 30 minutes, take the water adequately 2 to 3 liters, get good sleep for at least 6 hours. And depending on your lifestyle, do your exercises, aerobics, or any type of exercises is very important to control your metabolism, and it reduces the acne.
Right. And are these also the mantra for a glowing skin? Because Madhuri Soni is asking the same question, ma'am, what should I do for a glowing skin?
Glowing skin not from outside. It is just you in the inside. You can show to the outside world. So first of all, get confident you are good enough, and get a good diet, good sleep, and be calm, and think positive is very important. So do your work with a good energy, with your positive vibes, and go for a very healthy lifestyle, and then definitely you have a glowing skin. And also use as a dermatologist, I always tell the normal thing. People always say ये तो हमें पता ही था, इसमें कोई बड़ी बात नहीं है. लेकिन for glowing skin, you have in your basket a good products, a good cleanser, a moisturizer for the night time, and sunscreen for the daytime. and and depending on your skin condition, some other products if required. But for a glowing skin, these products are equally important as your lifestyle. So better lifestyle is very important for a glowing skin.
Right. So a good lifestyle is what you need. A healthy lifestyle is what you need to keep your skin glowing, and always keep a watch on what's going in. It's very important what you are eating, what you're drinking, how much sleep are you taking, how much stress are you taking, because that's going to actually make the condition bad, the stress bad. So please stay calm, cool, and enjoy your life. Life is beautiful. Doctor, another thing I would like to ask is that for a normal person, if he or she is not having any kind of skin issues, what should be his or her daily skincare routine like? Even if they are too busy to, spend a lot of time in skincare routine, what should be a very basic daily skincare routine?
First of all, early to bed and early to rise is the mantra. So if you can rise with the sun and do some yoga, pranayam, walk, whichever you can for 5 to 10, 15 minutes, uh, uh, as for your daily routine. And then some spiritual background is also important if you can. And for a very busy lifestyle, you just apply a sunscreen. Take adequate breakfast in your morning is very important, because it protects you for your skin and your health from the inside. Wear a good sunscreen and go to your work. And whenever you come from your work, uh, clean your skin with a good cleanser and apply a good moisturizer over your skin, because it can hydrate your skin and protect your skin from the various injuries you have faced in your daily routine in the whole day. And take again a good diet and go for a good sleep, and with a family time also is very important for your overall balanced life, for your good skin, your good health and everything.
Right. So again, for a healthy skin, you need to have a healthy, lifestyle. That is very important. And the most important thing is that you should be happy. You should be stress-free. That's really, really important. Doctor, we have already talked so much about sunscreen, the formulations of sunscreen, causes of acne, and how to, use sunscreen if one has a acne-prone skin. But what else should we know about sunscreen, and what else can we do to protect ourselves from the, scorching sun? People many a times will cover their face with a cotton cloth or dupatta, or use hat, or cap, and say that I'm protected from the sun. These are the best, protection clothing that we have. No need to wear sunscreen. What would you suggest or say to them?
These are called physical measures to protect the your skin, so they are also important. If you are going for a vacation or long time, you have exposure, like in the builders and constructors, we advise them cap or hat with at least 4-inch brim from your face. So with only sunscreen, they can't apply sunscreen every 2 to 3 hourly, because they have to stand in the sun for a long time. So in that type of scenario, you have to use the physical agents like caps and hats, full sleeves clothing. So for clothing, I also want to say a good type of clothing people are not aware. You should wear dark color, loose clothes, and with tightly woven threads is very important. Not use very tight clothes and very light clothes, whose skin are very prone for sun damage. They should wear a dark, loose clothes in the sun. So physical type of protection is required in that individuals we have a long standing time for the in the sun. So physical protection is again important. Like in various diseases, we advise like burqa. Burqa is actually our ancient time. People are more, I think, thinkers. The burqa is very good because it is dark colored and the cloth is very loose and the fabric is tightly woven. So it is best for sun protection. That's why I think they are the some of ladies are very
Right.
beautiful. Yes,
And we always had this notion that in summer we should avoid dark color clothes that they
yes, this
observe,
is a myth.
yeah,
This
this
is
is
a
a
myth.
myth, right. So that was interesting trivia. And as we are coming to the end or the concluding part of this session, Doctor, anything that you would like to add or tell our viewers as a concluding note?
For a conclusion of this session, it's a very good session for me also because I always want to share my views to all the viewers because awareness is very important for all of us. We I can talk, go to dermatologist, go to your doctor, but normal people can't run for simple things to doctors. So this is a very useful platform by various companies which we offer to connect the doctor to the normal people, so they can aware of the small things in our life, which is very important. People get malignancies, and nowadays skin malignancies are common in India, and it is my thesis topic in my PG time. So I get a lot of patient of skin malignancies. So I'm not scaring anyone, but it's not only your beauty, your wrinkles, it also about your health. So wear a good sunscreen and use a good moisturizer if you have the dry skin, because dry skin is very much got damaged with a small amount of sun. So cumulative effect of sun, 5 मिनट में कुछ नहीं हो जाता है, हम कपड़े डालने जाते हैं, हम 5 मिनट बच्चों को लेने जाते हैं, ये कॉमन एक्सक्यूजेस हैं जो पेशेंट्स देते हैं कि we got not a very exposed time with the sun. But the cumulative, the added effect of sun in the long run of time, it causes damage. Some amount of sun in your morning walk not harm you, but it is useful also to give you energy. But in the long run, you should wear a good sunscreen, and the use of a good moisturizer is very important. So it it is very important if you follow these instructions.
Right. So it's very important to, follow whatever Dr. Amrita has just told us. The whole purpose of this platform is that we can connect with the experts and connect you to them as well through the questions, etc. It was such an informative session. Thank you so very much, Dr. Amrita Srivastava, for your valuable time. It was a very informative session for our viewers, and it was great to hear you. We really look forward for many such sessions for our viewers in the coming times. Thank you so very much, Doctor.
Thank you so much.
And stay connected to our beautiful Spotless Skin page. And we would also like to thank our viewers. Thank you very much for your participation. Thank you. And for more information and updates on skin health and care, stay connected on our FB page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Instagram. Thank you, and good day to all of you.